Hello, I'm Billie Groom. Thank you for your interest in Canine Cognitive Behavioral Therapy, or CCBT. The following information applies to dogs over the age of 6 months. In this presentation, I provide a brief bio, explain what CCBT is, why it is effective in particular with adopted dogs, dogs in the adolescent stage, and in addressing behaviors associated with anxiety and aggression based on 1. The psychology guiding methodologies, and 2. Canine neuroscience. I learned my methodology from working with over 600 rescue dogs in the adolescent and early adulthood stages over approximately a decade, with the goal of finding a solution to behavioral surrender and euthanasia. I then developed the formula, Upward Dogology, and then applied the formula to over 150 dogs per year for a decade through live and virtual consulting. CCBT adheres to the principles of cognitive behavioral therapy, or CBT. CBT is a scientifically proven methodology designed to change perception-determining thought patterns which drive behaviors. Through exercises that harness cognitive skills, CCBT encourages processing and induces decision-making, allowing dogs to choose to change behavior. There is inherently no negative, harmful, or aversive elements. Let's dissect this definition. Number 1. Canine enrichment, for example, provides options. Options such as choosing the direction on a walk or which toy to take. There are no options provided in CCBT. By changing perception of the stimuli or environment, dogs choose on their own to choose their behavior. That change in behavior is not directed, encouraged, or discouraged by the human. Number 2, perception is how we view our surroundings. Think Umwelt. Perception is individual and is a factor determining how we feel. CCBT does not encourage dogs to feel a certain way. As perception changes, behavior changes. However, the emotion or feelings toward the stimuli or environment may or may not change at that time. CCBT takes a systematic approach that adheres to the principles of CBT, and I refer to these principles throughout the presentation. One principle is the need to establish skill sets to form a platform. With canines, these are in the form of command-based exercises. The way in which we teach and apply these exercises is different from standard training. The exercises accomplish 4 goals as we work our way through the program. Number 1, change perception of the human, create a bond, and establish a form of two-way communication. Dogs view the humans as recognizing their intelligence and emotions, knowing what is important to them, and having the ability to calmly manage situations. The exercises allow for two-way communication. They allow the human to read and understand individual emotions and thought patterns in each individual dog and to effectively provide calm guidance. This initial process occurs within a few days to a week, creating a bond and allowing for advancement. Number 2, they act as the transferable component. CBT does not rely on reinforcements, but rather on transferable exercises. These are initially established using rewards determined by the dog, and the human is responsible for recognizing those. The application commonly takes a week or so. The reward then becomes irrelevant, at which time the exercises become the transferable element. Number 3, resets the brain and changes thought patterns or perceptions. The exercises are applied holistically at non-stressful times to practice resetting the brain. When this happens, changes occur naturally in many situations. Changes in behaviors occur at different stages, and many unwanted behaviors are proactively prevented, meaning we never need to specifically address those behaviors. Number 4, change perception of the need to do a behavior to achieve a goal. If we need to address specific behaviors, we ensure we have the necessary platform exercises to the level required. As with all force-free methods, challenging situations are introduced at the pace of the dog to avoid flooding, discomfort, and failure. If we are not able to provide the dog with the skills to reset the brain during challenging times, we strengthen the exercises to bridge the gap from where we're at to where we need to be. So what are these exercises? I'm going to use 2 of the principles of CBT to explain why I cannot provide examples of specific exercises. Number 1, flexibility, creativity, and adaptability. The platform exercises are established, taught, and applied differently for each dog depending on many factors, including age, living conditions, that would be maybe a shelter versus a home versus a foster home, lifestyle and goal of the human, history, level of training, and reason for the behavior, meaning the dog's perception causing the behavior, which we may or may not know initially. The upward dogology formula allows us to easily establish, implement, and adapt the exercises as we work through the program. Number 2 requires application and feedback. Sounds obvious. Don't all methods require application? Yes. However, because the exercises reset the brain and change perception, the results or change in behavior vary. Although they may not appear to be directly related to the issue or behavior, they determine the pace and direction in which we progress. I have provided an example here. I should note the upward dogology formula can be taught as an entire methodology without application. To work with a specific dog, application is recommended. Why is CCBT effective in the adolescent stage? There are many ways to apply conditioning training, different methods such as operant or counter or classical. There's different techniques such as the clicker and the yes method, or to use positive punishment. Conditioning methods can be limiting in addressing behaviors common in the adolescent stage and ones with aggression and anxiety because 1, the intent, design, and principles of the methods, and 2, the brain development occurring during adolescence. Number 1, operant conditioning is designed to teach right from wrong by encouraging and discouraging wanted and unwanted behavior respectively, and to instill positive thought patterns through the use of reactive reinforcement. In other words, it takes a reactive approach. During adolescence, dogs apply their cognitive skills to think things through. They reason. Dogs who were perfect puppies learn they can rook their human. They may know right from wrong, but decide against doing the right thing. Adoptive dogs have learned what achieved their goal and see no reason to change that. These behaviors commonly result in these dogs being described as defiant, stubborn, or teenage-like. Continuing to apply positive reinforcement training often causes dogs to view their human as not recognizing their thought patterns, or respecting what is important to them, or even knowing how to calmly manage situations. This often leads to increased unwanted behavior, including ones associated with aggression. Relying on distraction or avoidance suppresses cognitive skills, leading dogs to getting frustrated. There is a difference between preaching patience to that of providing advice that generates patience. Expecting pet parents to rely on basic coping mechanisms and patience can lead to frustration, and they often don't feel a bond or a connection with their dog, and this can lead to surrender or euthanasia or to the use of aversive tools or methods. Educators rely on these suggestions such as avoidance, distraction, and coping during the adolescence in hopes that dogs will make it to the adult stage where brain development allows conditioning methods to be effective. This leads me to the second reason, which is brain development during adolescence. The hippocampus, which stores memory, particularly long-term memory, works with the amygdala, the part of the brain responsible for encoding surroundings and determining emotions, particularly fear. During adolescence, the connectivity between these two is compromised. Inhibitory neurons organize brain activity and synchronize networks to allow for processing before reacting. These begin to develop but are not fully developed until early adulthood. This delayed genesis results in emotions directing behavior without the ability to fully process, remember, and assess, leading to dogs being described as reactive or unpredictable. Counterconditioning relies on associative elements and desensitization. Associative training requires long-term memory, which is impaired during adolescence, leading to dogs being described as good 1 minute and not the next, or the method working sporadically. I've provided an example on the slide. Both desensitization and associative training require the stimulus to be present. Now, this can be achieved in increments to avoid flooding, but they need to be present. Because of delayed genesis, methods that require the stimulus to be present can be challenging due to reactivity. CCBT is effective in the adolescent stage because it does not require desensitization or memory. Another principle of CBT is the need for repetition, which is different from desensitization. The repetition is of the brain resetting, which allows for processing and decision making without the need for memory or for the stimuli to be present. Unwanted behavior is proactively prevented by allowing the brain to process before reacting. Based on the intent and principles guiding individual methodologies and brain development in different life stages, positive reinforcement training is most effective with puppies, CCBT with adolescent dogs, and force-free conditioning methods and CCBT with adult dogs. There is no one right way to work with a dog. The goal should not be to be right, but to get it right. Mindsets are evolving to include options, taking a proactive, holistic approach, being cognizant of emotions, kindness over dominance, human-animal bond, and decision-making. Educators, including behavioral veterinarians, ethologists, and animal psychologists who adhere to conditioning methods, struggle to provide advice that incorporate these mindsets and approach while remaining in the conditioning platform. The Upward Dogology formula puts these approaches into action. Now more than ever, trainers, pet parents, shelters, rescuers, and especially dogs are depending on the experts to provide solutions. My goal is to create a comprehensive program with the input of industry experts to teach canine CBT in educational institutions. I look forward to connecting with you, and I welcome your feedback and questions.